My name is Dr. Halima. I'm a consultant obstetrician gynecologist here in Gorimpa General Hospital, FCT, Abuja, and I'm a fistula surgeon. Vesicovaginal fistula, actually obstetrics, as the name goes, has to do with pregnancy and the journey of pregnancy. Most of the times, it's due to prolonged labor. We call it prolonged obstructed labor, a labor that has gone on and on without a final delivery, you understand, and there's no intervention to get that baby out until probably baby dies, the woman suffers. For most of them, the histories is that they have had labor for 2 days, 3 days, yeah, some of them 5 days, surprisingly, yes, as long as that. So they have labor for so long, they don't get delivered until probably the baby die in their wombs, and then after that, they develop the fistula. Some actually develop it, after the long stay of the labor. They go to hospitals, and probably before they are attended to, or after they're being attended to, in the process, they get the fistula. Yes, and then there are some that post-surgical complications such a situation can occur. Like we have all this series of patients on the ward at the moment that have had it from different causes, but the commonest cause is prolonged obstructed labor. The issue of vesicovaginal fistula sincerely is just prevention. If we can get that prevented, let it not even happen, then sincerely we are home and dry. But the problem is that it is not being prevented. How? Sometimes women don't go for antenatal. Even when they go for antenatal clinics, they don't end up delivering in the hospital. So you will see a large number attending antenatal, a few number coming to the hospital for delivery. Secondly, even if they're going to come to the hospital, they come to the hospital late. Sometimes the labor has gone on, the destruction has started, for whatever reason, probably sometimes finance. Most of them give us reasons that it's because of finances. They don't get money. They feel, people get afraid of coming to the hospital even before they are billed. They feel when they come to the hospital, they'll be billed. So, but they don't even come to know what it entails to get themselves out of that situation until when it has happened. So there's that fear of coming to the hospital. And then again, some of them feel that when they come to the hospital, they have to queue up, wait for so long. Waiting time is so long that they can't. So people have many reasons anyway why they don't come to the hospital. But also the socioeconomic status too. Let's be realistic. Poverty plays a very high role. Sometimes they don't even have the transportation to come to the hospital. Sometimes their roads are not accessible. Before a person gets himself or herself out of where she's living to the hospital, main hospital, it might take her hours. Once you are known to have fistula, you are so stigmatized that not just depression, psychosis, frank psychosis has happened to years in some women, whereby they get depressed because they can't do anything with their lives. You are not sick, as people will say. You're not sick. Yes, you're not sick, but you're really sick inside because you can't just do anything like every other person does. You don't have a freedom to associate with people. You don't have, in fact, sometimes you don't even have the freedom to even sell in the market. That is how bad it is. People don't want to buy from you. So if people don't buy from you, how do you survive? Then when you go to places, you're being stigmatized. People don't want to stay around you. They feel you're smelling. So their lives, in fact, the quality of their lives is really bad. So some of them get into depression. Some of them, unfortunately, go into prostitution, destitutes, homeless, so many things. Some of them are even being treated as so-called outcasts, witches, so many things. And then it even prevents you, even if you're a working class lady, you have such a problem. It's even worse. You can't go to work. And every time you go to work, you're feeling so insecure that probably as I'm sitting, I'm wet or I'm smelling or this, and you don't have a quality of life until you're away. So it's really something that disturbs women a lot. VVF surgeries, VVF management is just a damage control, and it is more difficult to manage a damaged thing than to create a new thing. But there's joy in it because once you do it and it works out fine, which most of the time we're lucky that it works out fine, you're happy. The patients are happy and you're happy. And you will see you will see yourself that you have transformed a woman's life from what was previously a nothing or is destitute to somebody who is happy and living. We have a lot of ambassadors out there that are ready to come today and tell you about their ordeal and what they are today. So by doing these surgeries, we help to restore at least their dignities. Because once you stop leaking, your dignity is restored in any way. Yes. So, and then we do have some NGOs, the governments, all forms of bodies that help in rehabilitating them and reintegrating them back into the society, because you don't just finish repairing and then the situation is still there. If you repair her and she still cannot go back to her community, or she still cannot be useful to herself, then there's still a problem. But when you repair her and that issue is settled, the next thing is that, okay, you have helped her in gaining her confidence. The next thing is that, what will she do? Yes, she needs to be rehabilitated, she needs to be reintegrated into society, and it becomes history. There might be some fields that there are new equipment in town, there are new personnel in town. Yeah, I know that. But for fistula, I'm not sure that we have gotten there yet. We sincerely need to do a lot more. Because if you see a patient with fistula, it tells us about our maternal mortality. So if our maternal mortality is actually improving, we have a good maternal mortality rate is improving, then I would say maybe fistula too. But what I don't understand now is that I still see new cases of fistula. And it baffles me that why are we having new cases? So something is wrong, somewhere fundamentally wrong. If we are still having new cases of I'm talking about new. In the past, we used to struggle with the issue of backlog because there were no specialists to repair them and clear them off. Now we have a lot of backlogs that have been taken care of or are still being taken care of. But we are having new cases. Where are we having new cases? Younger ones, older ones, multiples, para and nulliparas. We're having so many cases of fistula. Why? So that will give the answer to whether there's an improvement. Yes, that will give an answer, because I see that even our younger doctors are even leaving the country. We that were in the fistula now, we are getting older, we are getting tired. The younger ones that keep coming, I can't point out 5 young doctors that are interested in fistula. Yes, I can point them out to you. They are not in it, because one is the field is a difficult field. You come, you walk, and these things are not finishing. They're just coming, and it's just damage and damage keep coming, and then they leave. Who does it after? Who takes over afterwards? And anybody can fall a victim to this. So what happens if it happens? So I think it's something that we should take seriously in this country, so that we can do this thing. But what we need the most is prevention, because sincerely, if this thing is not prevented from there and it comes here as this thing, we continue to do this thing. And this prevention is not about the health workers alone. The health workers should be involved, the government should be involved, the parents should be involved, the children should be involved, the pregnant women should be involved, the husbands should be involved, everybody should be involved. I was surprised when I came into the system, came to the field, and I saw that there are really many of them living with it, many years. So I see that this fistula is there, and we should not neglect that aspect. We should take it very seriously, because every woman that is affected with this fistula, a whole family is affected. The whole family is affected, and every woman that is happy in a family, you see that the whole family is happy. So I just want the world to know that with good prevention, this will be history. It is history in other countries now. We see less of fistula, especially fistula, in many other countries. Why are we still having it here in Africa?